Power battles over the operating table. Nurses feeling intimidated. The health minister forced to act. Trouble at the heart of one of the UK's biggest health trusts. In an unprecedented move, the health minister has been forced to intervene at the Belfast Trust. It comes as efforts intensify to resolve what's been described as an intolerable working environment in its cardiac surgery unit, which has resulted in some operations being cancelled as some staff walked out. An inspection report, which UTV first uncovered into the cardiac surgical unit, described doctors behaving like gods. Shouting, humiliating and bullying are claimed. The health minister says it's time for it to stop. For hundreds of thousands of patients, this is the heart of the health service in Northern Ireland. But it's the heart surgery unit which has been causing so much controversy.
It was appalling.
It was more akin to something you would see in a Wild West bar.
This report is shocking.
Extremely concerning.
Flabbergasted.
But events inside the cardiac surgery unit have shaken confidence in the service to the core. The findings uncovered by UTV, detailing extensive accounts of senior doctors swearing and shouting at staff and throwing instruments in theatre, has now become the catalyst for more whistleblowers from different departments speaking up. And it is not just staff coming forward to report allegations of poor behaviour. Just listen to this patient's claim of what happened to her during a procedure in a different unit in the Royal Victoria Hospital.
I says, look, I'm really sore. Could you take a wee break for a wee minute? And here's me, this is really sore. Please. I begged and asked that doctor to stop. He never listened to me and he carried on doing the procedure. And I was crying and I says, please again, here's me, I'm so sore. This is really sore. Can you give me something to calm me down or something? Because it was really bad pain. He took off his gloves, he threw them on my chest and said, shut up. And at that, he turned and walked away.
She spoke to us following our revelations, but her experience was varied. A different surgeon carried out a second procedure the next day, and she had nothing but praise.
Now that other doctor who fixed me, he was a lovely doctor. So he was, compared to the first one. He reassured me, and said everything's going to be fine. And everything did go fine.
Warnings over difficult working conditions in parts of the Belfast Trust have been issued several times over many years in different reports and inspections. This is a significant move by the Department of Health to impose strict oversight measures on the Trust. The question is, how far will those measures go?
What has happened in the Belfast Trust is a classic example of weak management that has allowed issues to run out of control, and therefore they've lost a grip on that issue. And consequently, we have reports like we had into the surgical unit last week, which detail absolutely appalling behaviour between staff and issues that should never happen. So therefore we need to have those special measures. We need to make sure that the Minister is dealing with the issue and that the Trust are made accountable.
The Health Minister met with unions earlier this week. They left him in no doubt that immediate action must be taken.
Why do people think that they can get away with that bad behaviour without any consequences? And some of the issues that we need to think about is to identify what the size of the problem is. What are the contributing factors? So what are the things that are causing people maybe to behave badly? Is it pressure? Is it stress? Is it the working environment? And then I think the most important thing is that we all roll up our sleeves and work together to try and improve things, because it's for the patients and for the staff who work there, and patient safety is the most important thing in this scenario.
How are you going to act?
Well, so far I've had detailed discussions with the chair of the Belfast Trust and then with all the unions and the representative bodies. They're now aware that I am intending to make the first of what is likely to be a series of interventions later this week. I'll be making that announcement by a written ministerial statement so that MLAs, quite rightly, are first to know. and we're going to do everything we can to make sure we put this right, not just in the cardiac surgery unit, but anywhere where there's an issue over culture or behaviours.
And just what was it that has made you decide to take some measures against Belfast Trust?
Well, this has been going on for a number of years. When I spoke to the chair of the trust, he took me through the history from his point of view. When I met with the unions, they gave me their narrative of it. It's been going on for years. It has to stop.
The success of this trust is vital to the safety and confidence of patients. Changing its culture for the better will be critical. Appalling. That's how the Belfast Trust described the behaviour in the cardiac surgery unit, saying the actions of some were having a significant impact. That report, leaked to UTV, was never meant to be made public. Sharon O'Neill has the details.
They hold our lives in their hands, but news of bitter battles at the Belfast Trust has raised alarm at the highest level. Staff describe a unit in complete chaos, with senior doctors at loggerheads all the time.
They come like gods. They will verbally abuse individuals in front of everyone, the whole team. They are verbally abusive in ICU, theatres, wards. It is terrible everywhere.
Nurses are often piggy in the middle, trying to referee disputes between surgeons and anaesthetists.
These tensions in theatre cause risks through increased likelihood of errors.
The unit used to be safe, but it's been hijacked by a mob.
Toxic tensions, safety fears, more accounts detailing an unbearable situation.
The behaviours go unchallenged. However, the consultant surgeons can be really horrible to the nursing staff.
There was shouting that the whole team was killing a patient, shouting at the floor staff, telling them to shut up. The lead nurse was trying to support floor staff. They were told to shut up.
I fear speaking out because it will cause me trouble.
They shouted in front of us, "If the patient dies, I will tell the family it is your fault."
It was untenable and unfair to patients, a clear patient safety issue.
The Belfast Trust branding the behaviour appalling. The report states the issues had led to a significant risk to patient safety. But the Trust insists the unit is clinically safe with excellent outcomes.
It's completely untenable that I, as chair, and other health committee members haven't yet seen the report. We have got the Belfast Trust coming to engage with the committee next Thursday. We absolutely must have sight of the report in advance of that meeting.
Now clear, problems have been brewing for some time. Back in 2020, the Royal College of Surgeons carried out a review. It found what it described as a dysfunctional, horrible, hostile and toxic environment. A series of recommendations were made to protect patients.
The culture came under scrutiny again in November 2021 with another inspection report. It had to do with trainees, those the health service will rely on for years to come. We've seen a report which makes for some very uncomfortable reading. Trainees say some medical staff were unapproachable and very difficult to deal with. They say there was a lack of appreciation and they wouldn't recommend the unit as a place to work in. The conclusion, there appears to be no team culture or ethos.
At the core of this now is public confidence. People, patients in particular, need to be confident.
It's clear this crisis did not develop overnight. The warning signs were there. Restoring this unit to good health, another matter. Sharon O'Neill, UTV Live.
This is not the first time the Belfast Trust has found itself embroiled in controversy. There has been a string of crises over the years. Stuart Robson has this report.
The Belfast Trust has reiterated its apology to patients and families who were impacted by abuse at Muckamore Abbey Hospital.
The opening of Belfast's new maternity hospital is to be significantly delayed.
Staff whistleblowers have raised concerns over patient safety at one of Northern Ireland's biggest health trusts. A damning report examining the care of 44 patients who died while being treated by the former neurologist Michael Watt has exposed major failures in their treatment.
An organisation lurching from crisis to crisis. The Belfast Trust beset by problems year after year. In 2017, allegations surfaced of residents at Muckamore Abbey Hospital being physically and mentally abused. The County Antrim facility provided care for adults with severe learning difficulties. A police investigation led to charges being brought against staff and the hospital was shut down. A public inquiry concluded in March. The Trust issued an apology to families with the findings due to be released later this year.
My motivation would be that once I'm dead, that I know the safeguarding processes and the regulatory bodies will be in a much better place.
In 2018, more than 4,000 patients of neurologist Michael Watt were recalled amid concerns over his clinical practice.
I trusted him implicitly. I believed in what he was saying. I thought that I was really ill.
He was a consultant at the Royal Victoria Hospital. A medical tribunal led to him being struck off and the PSNI launching Operation Begrin. From concerns around some staff to the buildings that they're due to work in, the new maternity hospital at the Royal was expected to be completed in 2015, a decade on, and it still hasn't opened. Last year, high levels of Pseudomonas were found in the current building. It's not the first time the bacteria has been discovered. In 2012, 3 babies in its neonatal unit died after being infected. And a new children's hospital is still waiting to be built. Costs have soared and a contractor recently pulled out of the project. One former health chief says restoring faith in the trust needs to be a priority.
In some ways it's not unsurprising that it has issues to deal with, such as the scale and size of the organisation. However, it is undoubtedly the case that the recent report in the cardiac surgery department has really dented public confidence, and it's very, very important that there's now action to remediate the difficulties that they have.
Deeply concerning. That's how Professor Deirdre Heenan described the report. She's an expert on healthcare and social policy. Speaking to Paul Riley outside the Royal Victoria Hospital, she gave her thoughts on what the Belfast Trust needed to do.
How unusual is this step being taken by Mike Nesbitt?
Well, it is unusual, but it's up to him to decide how he is going to get back control. What oversight measures will he introduce? So, for example, he could appoint a senior civil servant to be in charge, to report back within a given timescale. He could go externally to the King's Fund, to the Nuffield Trust, and ask someone to come here and see what exactly has happened, set it in some context, but really what the public want now is transparency. How long has this been going on for? Why was it tolerated? What lessons will be learned? And how can we be assured that this will never happen again? Trust and confidence in health and social care in Northern Ireland is at an all-time low, and this is a body blow to the system.
The Belfast Trust said the behaviours were unacceptable and indefensible, and they welcomed the intervention of the department to help resolve the issues. The Trust's management is to set out how it will tackle the issues. If Mike Nesbitt is not satisfied, he may be forced to take further action. Thanks for watching.